love it. The calls.
You'll eventually get the 20% back. That Silver Connect card is going to pay her co-payments. Remicade, I believe, is an injectable, and her hospitalization co-payments. And tell them to turn his Part B on. Her name is Christine Bianchi, Chief Development Officer of the StayWell Center. Her office is on 80 Phoenix Avenue, but I'm proud to say her and her co-workers, particularly Don Thompson, who I'm friends with, have built the StayWell Center up from the little engine that could to now 3 huge community health care facilities. Community Health Center, excuse me. But I did say healthcare. I'm going to let Christine talk for most of the show today. We're going to have Dr. Anand Sadiq call in at 1:30. We're going to have our typical Medicare and You show. Let Stephanie Harris take it away with the Mattatuck Minute. Michael Regan, how are you this day in May?
Good, Mike. How are you?
Good. Dun, 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 dun. That's my friend Stephanie's intro on the iPhone when you call her. She's quite a football fan.
That's right.
All right. So, first of all, great newsletter. I know you're in charge of the marketing department over there.
Yes.
And you emailed me the newsletter. It looks good.
Oh, good. Excellent. Yeah, the last one that we sent out was all about family programming. We have a lot of really exciting things coming up in terms of trying to get children and families into the museum.
Right.
We have a really great relationship with the Waterbury Public Schools. I know we've talked about that before.
Oh, Dr. Phyllis Connors is so great to us.
Absolutely.
She is.
And our goal is to really transition the kids from coming in, just during school and when they're with their class on tours and bringing their families and their siblings back and enjoying the museum together outside of the school setting.
Because the parents are the ones with the money. So kids, get your parents to the museum.
Well, on Sunday, speaking of families, on Sunday from 1 to 3, we're having a stupendous still life program for families. It's the second Sunday of the month, and as you know, the second Sunday is always free for everyone who comes to the museum. So if you're on a tight budget or you're just kind of interested in what we might have to offer, stop by on Sunday. It's free admission, and you can walk around and see all the exhibits.
And that's Sunday from 1 to 3 p.m.?
From 1 to 3 p.m. And the families that come in, we're running a special program to take them through the Eric Forsman exhibit on the first floor, which is still lifes and landscapes. Teach them a little bit about what a still life is, what a landscape is, and then let the kids go crazy and create their own artwork.
Love it. Kids
Absolutely.
Going crazy is a good thing. Actually, one of my favorite noises or sounds is the sound of kids laughing.
Absolutely.
Not fighting, as I have twins, but laughing mainly. So that's celebrating Mother's Day with the Mattatuck Museum, creating your own still life paintings, stupendous
Absolutely.
still lifes. It's a free exhibit. It's from 1 to 3 p.m. And usually, you know what, it starts at around 5 of 1, ends at around 3:15. They're not kicking you out of the building at 3 sharp. So,
Absolutely.
if you're running a few minutes early or running a little bit over, that's fine. Bob Burns and his staff always treat people with respect and dignity.
Absolutely. And it's not just for, parents and kids either. If you're a grandparent or an aunt or an uncle and you really want to just get, your loved ones engaged, young children engaged in the museum, it's a great opportunity.
Right. It is. It's something I believe in. I'm on the board, and that's why we always have the Mattatuck Minute. Anything else? How did the first Thursday go?
First Thursday was excellent. We had a brand new performer to the museum, Brian Earl Jenkins. Seasoned performer, but first time here, and we had a great turnout and a lot of great feedback from his performance. And
Sweet.
We're looking forward to June's performance, and August is going to be in the courtyard. So we've got some exciting first Thursdays planned coming up.
And the soiree that's happening in June, why don't you plug that so we can at least get people interested in tying one on, or not, as Lynette would say. It's basically going to be a Madras clad fun fair. Can you give us a date on that?
Yeah, it's June 22nd.
Okay.
And it's an evening event. It's 7 p.m. to midnight here at the museum, and it's just going to be kind of casual, fun summer event. It's going to be a clam bake. We've got lobster and steak and chicken, music, dancing, a lot of really exciting auction items are going to be up for grabs. We're not doing the kind of standard auction items that you'd expect. It's going to be fun things like naming an ice cream flavor after you for the summer, and different things like that I think will be really exciting and different for people to get involved with.
Yeah, sweet. I'm really looking forward to that. June 22nd.
Absolutely.
Evening event. Tickets will be available at the Mattatuck Museum, I'm sure.
Yep, absolutely. Kathy and I are here ready to take your calls and answer any questions you have on that program or anything else
And that's
to do with museum.
203-753-0381.
Thank you very much.
My pleasure. Have a great day, Stephanie. Good to hear
You
your
too.
voice.
Bye.
Okay, so now I'm going to turn the show over to Christine Bianchi. She is going to, first of all, tout one of 3 provider practices in the state, the first and only community health center, which I'm going to let her speak at. I'm very proud to say that I spoke to her last week about a May 23rd date for a friend and colleague of ours. Victoria Veltri will be giving a speech on what it is to be a navigator with the Access Health CT. It's the Connecticut Insurance Exchange. Victoria runs the Office of the Healthcare Advocate, so I'm over at the StayWell Center. And Christine says, National Committee for Quality Assurance just gave us an NCQA rating. This is not easy to get. It's virtually impossible. So congratulations to you and the StayWell and all of your extremely hardworking employees. Take it away.
Thank you. So we are thrilled to be here today and to announce that we have received Level 3 2011 Guidelines certification for patient-centered medical home from the National Committee for Quality Assurance. Boy, that's a mouthful.
Yeah, it is. It is. I studied it in rehearsal a couple times. I'm like, don't botch this.
Right. What does that mean? Well, first of all, as you did note, we are the first and only community health center here in Connecticut. Go Waterbury, go StayWell. So to receive this certification at the Level 3 and for the 2011 guidelines, and there are 2 practices, one in Montville and one in Greenwich, who have also achieved this certification. But what does it mean to the people of Waterbury? That's really what we want to talk about and what's important, because we can have all the certifications in the world, but when you go into a doctor's office, when you choose a provider, most people, I believe, do not look at, well, let me see your diplomas and your degrees and let me see the paper on the wall. What's most important is what is happening in that visit. Do you feel heard? Do you feel cared for? Are you getting better? Are you maintaining a high level of health status? So those are the things that we look at as important, but we need to measure them. We need to know for certain that we are providing good care. And so what NCQA does is they provide a set of standards and then clear and specific criteria for how to improve primary care. They look at how is the care organized around patients so that you're patient-centered. Do patients feel like they're being heard, as I said? Do patients feel like they have access? So if they call, they have a question, what is the timeliness when someone returns their phone call?
Right.
How soon can they get in for an appointment? If you're sick, are our procedures and policies in place so that we can get you in right away and keep you out of the emergency room?
Okay. I know, because I'm in the health industry, and I've been advised not to plug any particular companies. I've got licenses, I'm allowed to say, with Anthem Blue Cross Blue Shield, United Healthcare, Connecticut, Aetna. The NCQA, what it is, it's a committee based out of Washington, D.C., directly addresses how case management services are delivered, gets right to the core of care coordination and quality of care, is designed for a wide variety of organizations. It's appropriate for health plans, providers, population health management organizations, which are HMOs, and community-based case management organizations, which is what Christine is with. The hardest one is the community-based because of the fact the clientele is a large diversification. It's not just the elite affluent people in Greenwich who are getting a quality $280 a visit on their Anthem or their United Healthcare plan. This program, and again, the paradigm shift goes to credit Christine. They take people because they're people, not for what their social status is. And the timeline, I don't know if you've tried to reach a dermatologist or if you've tried to reach any kind of specialist these days. They will say on the phone, it's about 2 to 3 weeks. And if you're a new patient, it's about 2 months. I'm like, you got to be kidding me here. Mm-hmm. So go Waterbury, go StayWell, keep plugging. You're doing great.
Yeah, well, our patient population right now is over 20,000. We have unduplicated patients.
20,000?
Right. Yes.
That's
so
incredible.
It is. It's 1/5 of the city of Waterbury who are receiving care at StayWell. And thanks to the leadership of our medical director, Sunil Dakuna, we really have looked at both the quality for individuals as well as being able to measure those outcomes across the populations. So as you mentioned, a comparison with a private practice is that unfortunately the patients who tend to be on Medicaid, Medicare, or uninsured have multiple health issues and really are much sicker than people who might live in more affluent communities or be privately insured.
If it's okay with you, we have a couple callers holding for you.
Absolutely.
Okay. Medicare and You, this is Michael Regan. How can we help?
Oh, hi, Michael. Hi, ma'am. I just wanted to say I'm a StayWell Center patient.
Okay, now remember, no names for HIPAA reasons, please.
No, I know that, but I just wanted to say I get the greatest attention and caring that I've ever had. Like you say, when you make an appointment with a doctor, by the time you get to the doctor, you already had to wake. But I just want to say, StayWell Center, when someone recommended to me a couple of years ago, I went in there, applied. Everybody was so courteous and patient with me, and then I've been going to the primary care doctor there, and even the dental clinic there. And I'm going to tell you, each and every one of those workers and staff are precious.
Oh, thank you. What was your first name again?
We're not allowed to ask that for HIPAA.
Well, my name is...
All right, go ahead. You're allowed to ask the first name.
My name is Andy. I won't tell you my last name.
No, please don't. But, Andy, thank you so much. And I think that your example that you just described of you go to various departments is one of the priorities for patient-centered medical home, and that StayWell tries to embrace.
And it's one-on-one.
Right.
And they're caring, and they'll ask you, what is this, what is that? They talk to you like they're family.
Absolutely. And we want to make certain that all of you is cared for. So your oral health is taken care of. We're doing the screenings that you need. So not just, you may have a cold or something that you're coming in for, but we're also going to remind you need a pneumovax vaccine so we can prevent pneumonia and the beloved colorectal screening that everyone wants to talk about, and because we want to keep our Waterbury family healthy and doing well.
Thank you for StayWell Center.
Thank you.
Hey, appreciate you listening. That was really kind of you. Doesn't it feel good?
That was very kind.
It does.
Absolutely.
I mean, that's one of the reasons she works 60 hours a week. All right, so that was great. Appreciate that call, and it's nice to know someone's listening. All right, keep talking. You are doing great. Obviously, the community likes you. That's a nice thing.
Yeah. Well, most of the time we do great work, and there are times when, we might fall down with 21,000 patients.
Right.
It's certainly a challenge. And so that's why coordination and tracking care are so important, so that we can measure what percentage of our population is getting the recommended pap smears or vaccinations or whatever other screens we're screening for tobacco use, substance use. And so performance improvement and constant measuring for our quality care is really incorporated into how we manage the organization and is critical. You don't want anyone to slip through the cracks, as they say. So we were an early adopter for electronic health records.
Electronic medical records.
Right.
Beautiful.
Yeah, so we're using technology in a way to help us make certain that our patients are healthier, are getting screened earlier, because unfortunately our folks are struggling here in Waterbury.
Yes, they are. And this economy is not bouncing right back. we have also a very diverse culture, and I like John, so I'm going to plug it. There is the gathering that's happening on the 18th. You're going to see all of what Waterbury has to offer. The beautiful Italian people who have taught me not to put the tomatoes in the ground until at least June 6th to 10th, according to Nani. You have your Albanians, which are unbelievably hard workers. They've come here with a backpack on their back and have built businesses. They own homes. Ed, good to see you, sir.
Hey.
Ed Flynn, the great Ed Flynn, just walks into the studio to say hello. Hope you told your beautiful daughter Reagan I asked about her.
I did, and I'll do it again.
Okay, so you have to respect
it's interesting you mentioned the Albanian population. We do have several staff who are Albanian and Albanian speaking, because it's really important that you, number one, can speak the primary language with patients, but also understanding the culture. So, because it really impacts healthcare. So one of the things we found is that many Albanians have a good, healthy diet. They're accustomed to eating, whole grain foods and fruits and vegetables, which we, recommend. But they are not familiar with the availability of pap smears, for example, or mammograms.
They wouldn't even hear of that.
Absolutely not. So, that is a re-education area that we want to get people screened early.
Right.
And with other cultures, again, there's other influencing factors that need to be addressed, but providers need to be aware of that and responsive to it. And we're pretty proud of our diverse providers. And
it was quickly adapted to, because I've known you I've known Dom for 20 years, but you about 10. And there was not, I always used to ask in the old days. Now we have plenty of Albanian employees. And I know you axe grinders want to call in and say, oh, no, everything's America. This is a melting pot. The Irish, I'm Irish. I'm a wannabe Italian because I love the Italian food. I speak a little Spanish because I feel that their money is just as green as some Irish boy from Cheshire, which I am from.
You could say Mirmim Jest.
I'm working on my Albanian. In the mornings, they would say Mirmim Jest. In the afternoon, they say Merdita. The word mir means good. You'd say Sia, means how are you. So I'm working on that. And
what a gift just to be able to say good morning to someone.
Their eyes light up.
Feel
like, are you kidding? Are you talking to me? So the Greeks, hard workers, they came here. Hopefully your families are doing okay in Greece. I know the Greek festival's this weekend, so good luck, Tula and all her friends.
Well, right, we have the best one. Lula Tracy is our CFO.
Okay, there you go.
Absolutely,
it's a melting pot. I love Waterbury.
Greece for sure.
So the StayWell Center, again, doesn't discriminate. You go in, your blood is red. It's actually brown, I've noticed. My wife had a procedure. It was through the tube, and I'm like, I thought the color was red. It's only red when oxygen hits it, which is funny. But we're going to have Doctor call in. Producer Tom's telling me we have to take a commercial break. Just listen in. Christine Bianchi with the StayWell Center. We'll be back in a few minutes. Thanks for